Good morning. This is Mike Rubino, guest hosting the John Fredericks Radio Show. Your Godzilla of the Truth is on vacation this week. But now I want to go to Delegate Chris Peace. Chris, thanks so much for joining me this morning.
Good morning, Mike, and Happy New Year.
Yeah.
As many of your listeners know, July 1st kicks off a new year for the Commonwealth, and based on the way this year has gone, I think it probably couldn't have come too soon. But actually, it's the beginning of the new laws that were passed by the General Assembly July 1st, as well as the state's fiscal year begins anew. So it is an important date on the calendar, and it's great to be with you this morning.
Great to be. Thanks for being here. So, actually, now that you mentioned New Year for Virginia, why don't we dive right in? First, if you can explain to the listeners exactly what your role is with the Virginia Consumer Healthcare Alliance and what the Virginia Consumer Healthcare Alliance is advocating for. Then I want to dive into that big legislative win that the VCHA was advocating for.
Well, thanks for the opportunity, as always, and appreciate John Fredericks to highlight the good works of the Virginia Consumer Healthcare Alliance. I'm proud to be a co-chair along with former Senator Roz Dance. We've been working for the past 6 to 8 months on building a grassroots and grass tops alliance that will provide education to the public about important issues, taxpayer issues. We are focused on protecting taxpayer dollars, making sure they're being spent properly, but also building on the work that we had done together in the legislature, creating greater access to health care and making it more affordable. We have a website that I would encourage your listeners to check out, as well as to sign up to get more information about the various projects and issues that we cover, and that's virginiaconsumerhealthcare.org, virginiaconsumerhealthcare.org. This year has been a great year in some respects, particularly with regards to health care affordability. We had an initiative in the General Assembly that we provided education to voters on. They contacted their legislators, contacted the governor's office to express support to end the practice of surprise balance billing, which has been crippling to many Virginia families. The type of event that no one wants, those emergency events where you're in the ER and you have a procedure that is done. You expect it to be covered. You have insurance, but because the provider's out of network, you end up getting a surprise balance bill that can be financially devastating to a family and a family that has just gone through an emergent situation. So we had legislation that was carried, a House bill and a Senate bill that passed, were signed by the governor, take effect today to end that practice.
Well, that's a big win, and I know that the VCHA was also active in the Medicaid expansion fight, so obviously an organization going places. They seem to be picking the right side of issues. But now I want to pivot, Chris, to exactly what we have going on in the age of coronavirus here in the Commonwealth. So the CARES Act is a bill sponsored by the U.S. Congress that is coronavirus related, an economic stimulus bill. It has sent Virginia more than, I believe, $6 billion intended to do a wide variety of things, including enhancing unemployment support for people who've lost their jobs, supporting our education system, and supporting the hardest hit industries like healthcare. So if you can, would you just walk me through exactly what is going on here with this CARES Act money that has been sent down to our governor?
Yeah, well, Mike, as you correctly pointed out, there's been about $6 billion that has been sent to the Commonwealth from the federal government in response to coronavirus and the collateral impacts that it has had. And the CARES Act provides about $3 billion of that total to the Commonwealth, and a significant portion of those funds are intended to support frontline healthcare providers involved in directly responding to the pandemic. At this point, based on what we've seen out of the Northern administration, that the executive branch has only released less than 1/3 of those funds, and that's a concern because the quicker those monies get to the street, the better positioned our hospitals, our providers are, and more sustainable they are to address any reoccurrence or uptick in the pandemic. We've seen that in other states. Currently, our numbers are trending in the right direction in the Commonwealth. But if we were to face increases or spikes as other states are seeing, we might be in a real situation, and we need those funds to be released to the front lines, to those essential industries and the localities as well.
Yes, I just saw that the governor moved us into another phase yesterday, so now we'll all be able to go to restaurants. Still no dining at a bar, but we can go to restaurants. So, Chris, this money, the way that I think about it is, the specific provisions made by this bill and the reason why it's so important to Virginians is that it supports things like community health centers, mental health and substance abuse services, nursing homes, which were
Right.
unbelievably hard hit during the
Exactly.
pandemic, rural hospitals, services for the elderly, and right? The list goes, I sound like Seinfeld. The list goes on and on and on. Um,
Unfortunately, you can't yada yada coronavirus.
I know,
I mean,
you really, you can't.
one of the things that the Virginia Consumer Healthcare Alliance has continued to emphasize, and I think this is nearly as important as getting that $3 billion released to these frontline providers that you identified, and that is to continue to practice safety in our own individual lives. Continue to maintain social distancing, mask in the appropriate places, hand washing, sanitizing, especially as many Virginians are looking at the 4th of July holiday week and weekend. We really want to continue to practice the standards that we've set here in the Commonwealth that have given us the numbers that I think we should rightly be proud of compared to where other states are. So the Alliance is working on legislation. We're working on education. We're working on taxpayer protection and accountability for the CARES Act funds. We also want to bring that solid PSA to folks and the reminders. When the summer weather is here, it's nice out. It's very easy. Human nature is predictable, and we want to make sure that we continue to be safe individually in our families and as a community.
That makes complete sense. Now, when it comes to this money, I know that the Northam administration has essentially been in the driver's seat to making decisions. Is there a way for our listeners? You mentioned VirginiaConsumerHealthcare.org, or is it Virginia Consumer? Yeah, it is VirginiaConsumerHealthcare.org. I just pulled it up. I just want to make sure there wasn't Alliance in there. So, is there a way for our listeners to join in this? I think that no one is more prudent than a John Fredericks Radio Show listener when it comes to being fiscally responsible. So, how can one exercise that fiscal responsibility and contact the Northam administration? How can they make sure that these funds are allocated properly and that they're allocated quickly? I think that that's what you mentioned is so critical, is that we're still in the middle of this. Even if the state's opening back up, we still all have to practice social distancing, a thing that I love, by the way. But it's very important for us to be not just conscious of ourselves, right? In this 2020 year, it's so easy to be just conscious of yourself and your feelings, but it's also important to realize that we live in a great Commonwealth, and this money was meant to further enhance the greatness of the Commonwealth in the face of a deadly virus. So how can people get involved? How can they contact the governor? What is it that people can do to further the mission that you're on?
Sure. I mean, it's a great question. That's the essential question, and it's what makes us successful. When people look around and they see a world that's changing, they may become dismayed. They may feel that their voice has no impact. Efficacy is so important, whether it's a voter or a constituent lobbyist that is wanting to make a difference and contact the governor about this very important issue regarding $3 billion of CARES Act funds to go to the Commonwealth's front line. go to nursing homes, go to hospitals, go to health centers. People should know that when they raise their voice, it is heard and it does make a difference. We've shown that as an alliance with the legislation that passed this past General Assembly session to stop surprise balance billing. On this issue in particular, they can tell the governor's team to provide that federal relief to the front line. They can call the governor's office. The number is 804-786-2211, 804-786-2211, and ask them to provide CARES Act relief funds to Virginia's healthcare providers. It's incredibly important at this critical time. While our numbers are going in the right direction, we want to be well positioned for whatever may come in the future. And individuals can make a difference in this society. We have proven that with our record as Virginia Consumer Healthcare Alliance, and on this issue, we can make a difference as well.
This is Mike Rubino. We have Chris Peace with us, the co-chair of the Virginia Consumer Healthcare Alliance. Chris, are you a Virginia mover, shaker, or are you a policymaker?
I'm an attorney, and that may be, I don't know, a controversial term, but, I'm a former legislator, co-chair of this great alliance, and practice law for a living. So I'm proud to be a citizen of the Commonwealth. That's probably the most important title I could have.
I think that's a very good apt description. So, you just told us that everyone should go contact the governor at 804-786-2211. That way we can follow the funds, figure out exactly where this $6 billion has gone and why it's not being sent to every healthcare facility across Virginia to make sure that if the pandemic comes back, as it's seemingly doing in other places, that we're well prepared. Now, with the last 3 minutes here, I wanted to just run through, you talked about the big win on surprise and balance billing in the legislative session this past year. Today is the new year in Virginia when it comes to bills. Talk to me about exactly what bills go into effect today that will make the most impact in the lives of, the Virginian.
Well, thanks for that question. 3 minutes, it's a lot of ground to cover, but there are hundreds of new laws that'll take effect today, July 1st, that could affect, 8 million people's lives in Virginia, over 8 million Virginians' lives. And our alliance, we're a bipartisan or frankly a nonpartisan organization. We find that healthcare is a nonpartisan issue, and we've been focused on healthcare affordability and accessibility. But more than 1,200 bills were passed by the legislature and signed by Governor Northam, and most take effect today. I think your listeners who are fiscal conservatives probably had great concerns about the minimum wage increase to $9.50 per hour. That will not take effect today. That will not take effect until 2021 based on a governor's amendment that came in at the height of the rise in the coronavirus at the time where we all were told to stay at home, and restaurants and other retail establishments were closing their doors and people were losing jobs. So that minimum wage increase won't start until 2021. There's a law banning holding a cell phone while driving. That won't take effect until January 1st of 2021. But most all other legislation takes effect today. One that John Fredericks, I think, would be very interested in is that lawmakers voted to legalize casino gambling in 5 cities, including Richmond, if voters give their approval in local referendums. The other cities are Bristol, Danville, Norfolk, and Portsmouth. John's been a long-time supporter of horse racing in Virginia and Colonial Downs in particular. While I was in the legislature, I was part of an effort to reopen Colonial Downs, and we did that successfully. And it has been a great benefit to not just the county of New Kent, but the Commonwealth as a whole. There are many new laws regarding education, and safety, gun laws. I think we saw a petition for injunctive relief in Goochland filed by the VCDL that did not go forward regarding the one gun a month repeal, or the requirement that you can only buy one gun a month, repealing the law that we passed saying that you could consume more than that in 1 month. There's also a new requirement for background check on all firearm sales and a limit on, as I said, on handgun purchases to one gun a month. One that I think is kind of under the radar, but also related to healthcare, is that health insurance companies are going to be limited to charging a maximum of $50 per month for insulin. Virginia is creating a state health exchange rather than relying on federal marketplace as well. A couple of issues regarding healthcare that have maybe flown under the radar. But the laws run the full spectrum of one's life, from decriminalization of marijuana to transportation authorities and tax increases. Legislators raised the gas tax by 7.6 cents a gallon, and they created an authority for the Richmond region, much like Northern Virginia and Hampton Roads have. So it was a very, very active General Assembly session this year, and most of the new laws will take effect today.
Well, that was you did a good job on that, I'll tell you that much. Chris Peace, thank you so much for joining me. This is Mike Rubino guest hosting the John Fredericks Radio Show.